Welcome back. This past week, we broke the story about MU Healthcare's surge capacity to take care of COVID-19 patients and the concern for having enough staff. Tonight, we'll take you inside one of the incident command meetings where MU Healthcare leaders discuss the issues of staffing and capacity during the pandemic. KOMU 8's Alex Engel has been following this story all week. She joins us now in the newsroom to give us an exclusive look into one of those meetings. Alex.
Emily, these incident command meetings have been holding since March, but on Friday, for the first time, I was able to observe how the team plans for the future. When the clock strikes 9 in the morning, MU Healthcare leaders hop on Zoom.
We look at this virtually every day, some of us way more than one time a day.
More than 15 people gather together to discuss hospital operations, all with different jobs.
I'm the chief of staff, so organizing physicians is a lot of what we do.
Alpers, and I'm the interim chief human resources officer, and I report out on the people side of things.
I'm the emergency management coordinator.
They are working together for one common goal.
We look every single day to say, how are we doing? We're looking to the future.
To do this, Chief Nursing Officer Mary Beck says the command team focuses on one thing.
And are very much data-driven for how we're making our decisions.
On Friday, Dr. Stephen Witt, co-leader of the team, took the group through the numbers.
We have 46 active COVID patients in-house. We have 30 additional patients who are admitted with COVID who are now off isolation.
The team also checked in on the PPE supply.
Glove data, we have some that have turned yellow and red. We actually received in several pallets of gloves this morning, so those numbers will go up and recover to green again.
To help with the PPE supply, MU Healthcare has cohorted COVID-19 rooms, meaning 2 patients in 1 room.
The biggest risk to a healthcare worker is when they are removing the gown and all, and so the least amount of times that they need to do that is better.
Dr. Wint went over prevalence rates in the 23 counties MU Healthcare serves. Boone County was at 9.53 active cases per 1,000 Friday. Witt then brought up the number they care about most, the virus's reproductive rate. If it's under 1, the virus is spreading slower, then we're getting over it.
We're right at 1, which is holding steady. Steady is not great. We're still pretty stressed, but as long as it's not rising, we're okay.
This week, through a public records request, we found out MU Healthcare has enough space to take care of almost 300 COVID-19 patients if needed. But enough space doesn't mean they would have enough staff.
The biggest challenge, I think, really will continue to be our staffing on a daily basis. And because it's the challenges that we all face personally, that our staff face personally.
Along with looking at the data, Incident Command also ensures staffing is sufficient every day. MU Healthcare will continue to adapt to the changing circumstances of COVID-19. But the thing that'll hold steady through it all, the morning meeting. I was only allowed to join the first part of the meeting. The only thing I was told about the other part was that they would be talking about issues not open to the media. In the newsroom, Alex Engel, KOMU 8 News.